I took a lot of science classes at the health science building, and I remember when they were almost done building, and I would just stare at the building like, I'm gonna be there one day.
It was nothing but a dream. It was a part of our imagination for a while to think about what actually could be. And now this facility is literally changing the lives of thousands and thousands of dental patients across the state.
There's really two North Carolinas. There's the urban North Carolina and the rural North Carolina. And the urban North Carolina was pretty well taken care of with the number of dentists that they had. But the rural North Carolina was really lacking in the number of dentists.
It feels just like yesterday. We were in design mode for this school, who we would serve, how we would serve them, where we would serve them.
It had not been done before, but we figured if we were going to do it, we had to have a model that might be able to better address the needs of North Carolina.
When you lead something like this, you don't just go out into communities in North Carolina and tell them what you're going to do. You go out into communities in North Carolina and you ask them what they need. And then we work with them to build the product that will ultimately deliver on those needs.
It was particularly exciting because we had folks from the western part working with the eastern part.
This was a dental school where we built Ross Hall, which was 3 floors. Dental students came in on their first year on the first floor, second year, second floor, third year, third floor, and then you break up that 4th floor and you extend it out and you put those 4th year students out into the 8 service learning centers around the state that needed oral health care the most.
Recruit candidates for dental school from those areas, so we give them a good education and then have them go back and practice at home.
When we first came here, North Carolina ranked 47th in the nation in the dentist to population ratios. We're more now like around in the mid-30s. And so it's a pretty significant difference that already those ECU School of Dental Medicine graduates are having an impact in the communities across the state.
Our graduates are now practicing in 63 of our counties.
90% of them are practicing in North Carolina.
I strongly believe in the mission of this school to serve the underserved.
It was one of the reasons why I mainly applied and tailored my application to ECU. I knew they wanted to serve people in rural NC where we don't get a lot of attention.
We are all absolutely committed, and that's really part of our institutional DNA.
And we actually have some patients, that have high anxiety, and when we're trying to talk about their different treatment plans, they're always like, what would you do if I was your mom? If you're in my chair, you're my family. You're my dad, you're my mom. I'm gonna do the best for you that I can.
I'm here to get a root canal. I know people find it strange, but yes, I'm excited because my beautiful daughter is doing it.
I'm actually in the middle of performing a root canal on my mom.
She actually did a root canal on her father, my husband as well.
She had 4 sisters, low-income family in Rocky Mount. She didn't have a lot of childhood care growing up for the dental, and when she started working at 16, she got dental insurance and she started trying to get back her dental health. And I've seen that a lot in the CSLCs. They have the same story. They didn't have that proper childhood care. Unfortunately, their mouths took a turn for the worse, and they've been trying to improve it ever since.
When we talk about underserved populations, a lot of times those people are people of color.
Patients deserve to be able to have healthcare professionals who look like they look and who share common cultural values. North Carolina right now is about 33% of the historically underrepresented races and ethnicities. Our goal really is to either reach or achieve population parity. This year's class coming in is about 39% historically underrepresented races and ethnicities.
As a healthcare professional, it is a part of our job. We are here to help, we're here to give, we're here to treat. And in the midst of a pandemic, people need that all the more. And so it's more of a reason why I choose every single day to show up and put forth my best effort in giving to the underserved.
I hear all the time going out to the national conferences, oh, you're from ECU, they have a great program there. We really focus on clinical experience, and the dentists, they always look for that, and they're excited to see that we're applying.
We want to continue to grow research so we can continue to provide better treatments and more cost-effective treatments and continue to grow the areas around our community service learning centers.
One of the things that we'd really like to see at some point in the future is an opportunity to have other health providers co-located within our community service learning center communities. Nurse practitioners, physician's assistants, or other primary care providers, because dentistry needs to be part of primary care.
We still have populations out there that we need to concentrate on. The special needs population that requires special care. We need to find a way to begin to move in that direction as we move forward.
We've kept our promises to the people of North Carolina. We are fulfilling what we had said that we were going to do from the outset.
We had our skeptics as we started. We had some that were pretty vocal. The interesting thing is, as time has gone by, those skeptics have disappeared. One or two I've got little notes that I will keep for a long, long time from people that said, I had no idea. I should have known better. What ECU is doing is great. Keep up the good work.
To think about serving more than 80,000 patients around this state 10 years later, that is what student success, public service, and regional transformation look like in action.